Language delays can arise from various physiological reasons, including hearing impairment, tethered oral tissue like a lip, tongue, or cheek tie, oral hypotonia, which is low muscle tone in and around the mouth, orofacial clefts like lip, cleft lip, or palate, eustachian tubes misalignment, apraxia of speech, and that's where the brain struggles to send signals to the mouth muscles, or sensory processing difficulties. That's when children have difficulty interpreting and responding to sensory information from their environment. If you're concerned about your child's hearing, it's important to reach out to your child's pediatrician and ask about scheduling a formal hearing evaluation. If you suspect that your child may have tethered oral tissue affecting their ability to form words, consulting with a pediatric dentist specializing in this area is a great first step. Indicators like struggling to latch onto the breast but having no issues with a bottle nipple as an infant could suggest the presence of a lip, tongue, or cheek tie. You can do a little test at home by having your kiddo stick their tongue out, and if it's heart-shaped at the end, that could be a sign that your child might have a tongue tie. Sometimes tethered oral tissues can grow back, so if your kiddo had treatment for any type of tie in the past and they're having trouble now with their speech, just know that it can grow back and you may want to get that checked out. Oral hypotonia is where the muscles in and around the mouth have low tone, which can lead to several noticeable symptoms. Children with oral hypotonia often have difficulty with speech, resulting in slurred or unclear speech because they have weak muscle control. They might also experience feeding issues, struggling with sucking, chewing, and swallowing food. Symptoms can include drooling or an open mouth posture, and it may seem like the child just has no control over their tongue or their mouth movements. Orofacial clefts, such as a cleft lip and a cleft palate, are openings or splits in the upper lip or roof of the mouth that occur when facial structures don't fully develop in the womb. Sometimes these clefts are so minor that they go unnoticed until a child starts having feeding or speech problems, which can prompt a closer look and lead to a diagnosis. When the eustachian tubes in the ears are properly aligned, that means that the tubes are positioned and functioning correctly, allowing air to flow freely between the middle ear and the back of the throat. This alignment helps maintain equal ear pressure on both sides of the eardrum, and it allows any fluid in the middle ear to drain properly. When there are issues with the eustachian tubes, as in they're misaligned, this can lead to fluid buildup in the middle ear, causing hearing issues. For young children, this can result in delayed speech development because they're not hearing sounds and words clearly, making it harder for them to learn and mimic language effectively. If your kiddo has strong receptive language skills and they can communicate effectively through nonverbal means, as in like using their body language to convey an entire story, it may indicate apraxia of speech. This can make it really difficult for your child to form words, often resulting in speech that sounds jumbled or unclear. These children know exactly what they want to say, but they struggle to physically produce the words accurately. Children who struggle with processing sensory information may experience delays in speech development because their brains find it challenging to interpret and respond to what they hear, see, or feel. When sensory signals aren't processed efficiently, it can affect how they learn and use language. For example, difficulty with auditory processing might make it hard to understand and imitate words correctly. Likewise, sensitivity to certain textures or sounds could distract them from focusing on communication tasks, among other things. Addressing sensory processing challenges can be key to supporting their speech development and overall communication skills, as well as overall development. If you haven't already, please download our sensory integration guide as it goes into way more detail, provides clear examples of what it looks like when a child is having difficulties processing sensory information, and it gives great strategies and activities to help your child with their sensory processing needs.